Back pain that comes from a damaged disc usually comes from a small part of the disc that's causing the pain. In the area of injury to the disc, there's actually a response of the body called inflammation, and there's an ingrowth of painful nerve fibers into that area of the damaged disc. Most damage to discs only occurs in about 5 to 10% of the disc, and it affects the outer part of the disc called the annulus. Most surgeries designed to treat damaged discs, called degenerative disc disease, cause fusions of the spine by removing the entire disc and fusing the bones together, therefore limiting movement. With the Deuk laser disc repair, we focus in on just the damaged part of the disc and repairing that injured part of the disc only. There's no need to remove the rest of the disc, which is still functional and allows you to have normal movement in your spine. Our surgeries are designed not to fuse the spine. It keeps you in normal spinal movement. To repair this damaged part of the disc, we use lasers. The approach to this disc with the Deuk laser disc repair does not involve removing any bone from the spine. Other types of laser disc repairs that are being done involve drilling away or removing windows in the back of the spine where there are bones that stabilize the spine. These bones are called the spinal lamina, and spinal lamina connect to the facet joints, and the facet joints are what give your spine stability. They prevent abnormal movements of the spine, such as lateral bending, slippage of the spine, or rotation of the spine. By removing parts of the spine to get to the disc, most traditional spine surgeries destabilize the spine. There is a recurrent disc herniation rate with these types of procedures that has been reported in the literature to be between 10 and 35%. Recurrent disc herniations that are symptomatic will require a second surgery to repair them, and possibly a spinal fusion such as the one you're seeing here. With the Deuk laser disc repair, we remove none of the bones of your spine. We leave those natural bones where they are. We focus on getting to the disc through alternative means around the spine, therefore preserving the bony spine and its joints. Other differences between the Deuk laser disc repair and percutaneous discectomy include differences in approach. Percutaneous discectomies are done through needles. They are needle procedures where a needle is introduced into the damaged part of the disc, and using a bipolar or a laser or suction, the damaged part of the disc is sucked out through a needle. In my experience, these techniques do not usually work. The Deuk laser disc repair is done under direct visualization by a spine surgeon, not a pain management doctor. And the disc is actually repaired, and it's visualized through the use of an endoscope. You can actually see the damaged part of the disc, and using a laser it can be directly repaired. The Deuk laser disc repair is done outpatient, and patients are able to go home 30 minutes after the procedure. There's no need for hospitalization, and complications are extremely rare. Patient satisfaction is very high, over 98%.